Hello, my name is Dr. Dewan S. Raja. Today I will discuss about schistosomiasis, also called Bilharzia. This is a chronic parasitic infection caused by blood flukes of the genus Schistosoma. Etiology: the parasite causing the schistosomiasis. Schistosomiasis is caused by blood flukes of genus Schistosoma, as we mentioned. Clinically important species are Schistosoma mansoni, venules of large intestine, lateral spine on the egg; Schistosoma hematobium, venous plexus of bladder, terminal spine on egg; Schistosoma japonicum, small intestine is a site, and egg has small lateral knob. We have others like Schistosoma meckongi, Schistosoma intercalatum are less common. Life cycle of schistosomiasis: eggs excreted in the urine. There is Schistosoma hematobium or stool in case of others. In fresh water, eggs hatch, develop miracidia. Miracidia infects freshwater snail, and snail is the intermediate host. From snail, Cercaria released, swim freely. Cercaria penetrates human skin and becomes schistosomule. Migrate via bloodstream, mature in liver, adult worms pair and live in venous plexus. Adult lay eggs. Pathology is mainly from host immune reaction to eggs. Okay, this is life cycle according to CDC. Okay, so if we go from here, eggs shed from the infected human in feces or in the urine. In the urine, mostly the Schistosoma hematobium, Schistosoma japonicum, and meckongi, it is going out through the feces, also through the feces, Schistosoma mansoni. Okay, so this route, it will coming out of the body from human, it go this egg hatch and release miracidia. Okay, that miracidia in the water will go to the snails. Miracidia penetrate snail tissue. Sporocysts develop in snails by successive generation. Free swimming Cercaria released from snail into water. Cercaria penetrate skin. Cercaria lose tail during penetration and become schistosomule that reaches the circulation, migrate to portal, blood in liver, and maturation into adult. Then we are seeing here male, female here, the paired adult worm migrate to mesenteric venule of bowel rectum, laying eggs that circulate to the liver and shed in stools. Okay. Venous plexus of bladder, egg shed into urine, particularly the Schistosoma hematobium. Okay. This is the egg of Schistosoma hematobium with a terminal spine here. We are seeing is the terminal spine. So, what are the clinical features? Acute schistosomiasis, also called Katayama fever, occur 2 to 8 weeks after exposure, especially Schistosoma japonicum, fever, arterial rash, cough, eosinophilia, diarrhea, lymphadenopathy, hepatosplenomegaly. It is an immune complex mediated hypersensitivity reaction. Chronic schistosomiasis pathology mainly due to granulomatous reaction around eggs. Organ-specific manifestation, intestinal, Schistosoma mansoni and Schistosoma japonicum, pathogenesis of hepatic fibrosis leading to hepatosplenic schistosomiasis japonica. So, Schistosoma japonica egg, what happened? From the egg, there will be soluble egg antigen that will come in contact with the macrophages that will work with CD4 plus T cell. Then T lymphocytes secrete IL-2, IFN gamma, and TNF, driving a cell-mediated response. There will be early granuloma. From there, as the granuloma becomes organized, T cells takes over and secrete IL-4, interleukin 5, interleukin 10, and interleukin 13. Matured granuloma, TNB lymphocyte, macrophages, giant cell, epithelial cell, mast cells, plasma cell, eosinophils, and hepatic satellite cells, and fibroblast. Then, late stage granuloma, here fibroblasts replace majority of the cell and mediate collagen deposition, resulting to fibrosis. Moderate fibrosis, okay, here severe fibrosis, dilated esophageal varices, and enlarged spleen by MRI image. So, what are the manifestations of organ-specific manifestation of intestinal Schistosoma mansoni, Schistosoma japonicum? Chronic abdominal pain, intermittent bloody diarrhea, hepatosplenic disease, Seamer's pipe stem, periportal fibrosis, portal hypertension, splenomegaly, varices. These are submucosal venous spaces that will be dilated in the esophagus that may lead to vomiting of blood or hematemesis. Liver function often preserved, non-cirrhotic portal hypertension. So this is Schistosoma pipestem fibrosis ultrasonographic image in hepatic schistosomiasis. Note the central periportal fibrosis here. White arrow and fibrosis in the periphery of the liver. This is the red arrow, fibrosis periphery of the liver in a patient with advanced hepatosplenic schistosomiasis. Urinary manifestation, terminal hematuria may be painless hematuria initially, but that may be changed to dysuria or burning sensation during micturition. So hematuria is painless, but there is also painful micturition, dysuria. Bladder wall fibrosis with calcification like this. Hydronephrosis, collection of urine or dilatation of the renal pelvis and the calyces, and the kidney size may be increased. Due to blockage of the outflow or stagnation of the outflow. Strong association with squamous cell carcinoma. Here is the squamous cell carcinoma. Here is calcification. So the transitional epithelium of the bladder will be changed into squamous cell. May that lead to squamous cell carcinoma. Here, this is one type of metaplasia from transitional epithelium to the squamous cell. And squamous cell will go through cancerous changes. We call it squamous cell carcinoma. CNS schistosomiasis, mostly caused by japonica, cerebral granulomas, seizure, focal deficit, Schistosoma mansoni, hematobium, spinal cord disease, transverse myelitis, cutaneous schistosomiasis, if you look at that, cercarial dermatitis, swimmers itch, if the person swim in a snail infested pond or lake where the people with the schistosomiasis defecate or urinate or swim there. So in that condition, we'll get the local pruritic papular rash occur at the site of penetration. Severe reaction can occur in non-human schistosome exposure, that is bird schistosomes. Okay. Diagnosis: parasitic urine microscopy to find out Schistosoma hematobium eggs with terminal spine. Stool microscopy for Schistosoma mansoni and japonicum. Eggs may require concentration technique, catocase. Serology useful in early infection or low egg output. EIA stands for enzyme immune assay for circulating antigen CAA, imaging ultrasound for periportal fibrosis, X-ray for bladder calcification, MRI CT if CNS involvement. Treatment: first line treatment is praziquantel 40 milligram per kg for Schistosoma hematobium, Schistosoma mansoni, 60 milligram per kg for Schistosoma japonicum, given 1 to 2 divided doses. Mechanism: how this drug works: increase calcium permeability, paralysis of the worm. With some note: most effective against adult worm, praziquantel. For early infection, catamera steroids may be added due to strong immune response. So prevention certainly will give health education, not to defecate or urinate in the pond or lake where people swim or have their bath or they use that water any other way. So that should be avoided. Snail number should be controlled. Okay. We'll avoid freshwater exposure in endemic areas. Snail control. Mass drug administration like praziquantel in high-risk communities. Improve sanitation. Safe water access. And that's all about schistosomiasis or Bilharzia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.